The initial phase for someone with IT band syndrome, we are first going to do a full orthopedic assessment. So we're going to look at hip range of motion and strength, and also look at a running analysis. So we want to get an idea of both how their body moves in general, but also look at specifically what they're doing in that activity of running, since that's the thing that they want to get back to doing. So in this stage of the game, with this person specifically, they had very acute outside of the knee pain when they would be early on in their runs. So typically within that first mile, they were starting to get some pain in that outside of the knee. So we wanted to get them on the treadmill and get a good sense for what was going on there, if there was anything mechanically speaking that jumps out that we could tweak and change early on. Oftentimes with these patients, the first things that we will go after is that gait retraining. So working on increasing cadence, and also working on where their foot is hitting in relation to their hip. So instead of focusing on a heel strike or a forefoot strike, we're looking at getting that foot to land more under their center of mass. That is most commonly what we see within this type of patient. From there, in the orthopedic assessment, a lot of times we will see weakness in that outside of the hip, specifically in that glute med, which is causing some of that increased stress through that IT band. We will also see a lot of times tightness through sometimes that front of the hip. So our IT band connects into a muscle in the front of our hip called our TFL. And that muscle, a lot of times we will notice is very tight in this individual. Phase 2 of this, we'll kind of dive into what we would do to assess or address some of that tightness and some of those weaknesses, and then kind of build from there to get this person back up and running.